lovely Murrayfield. It's lovely actually to be back in Edinburgh and speaking here because my academic and professional life started here in Edinburgh more than 50 years ago. And I was driving around with friends and colleagues last night, passing exactly where I started as a first-year student at Edinburgh University. So fabulous to be here. It is quite a time to be thinking about midwifery, and I'm sure it's all front of mind for all of you. Women, babies and partners and families are experiencing a maternity system that is unprecedented in the UK. There's reports of traumatic experiences for women and babies and partners and families that we hear about regularly. There are higher levels of intervention in birth than we've ever seen. We haven't experienced this model of care before. We see a focus on birth, labour and birth perhaps, almost to an exclusion of thinking about what's happening before in pregnancy or after postnatally and the first weeks of the baby's life. We're seeing marked inequalities in experiences and outcomes. We're seeing long-standing workforce shortages and kind of a mismatch between staffing and the model of care, if you like. An often hostile public debate about midwives and midwifery. It's a very bruising time to be in the field. I'm going to take a big step back today. I'm not going to talk about that. I'm going to talk about why midwifery matters. I'm going to talk about the incredible contribution that midwives make to women, babies, families, communities and societies right across the world, and right here in Scotland and in the rest of the UK, and the contribution that you are all making to women, babies and families every day of your life, even when it feels like this. I'm sure you've all seen McTominay do this in the last 10 days. If you haven't, find him. Do you know what he said after he did this? He went running around the field and he was looking up saying, "Where's my mum?" he said. Even on the days where you have to do this upside down and back to front and still get it right, that's what midwifery is doing at the moment. Midwifery is, of course, a global profession. It's stronger in some countries than in others. UK midwifery has long been a role model for the world, and people have looked to UK midwifery, are still looking to UK midwifery to know how to do it. But in virtually all countries across the world, midwifery has a tough time. It struggles for recognition. It struggles to be able to do what midwives know is important for women, babies and families, and for its proper place in the system. Midwifery is both a joy and a struggle pretty well every day, wherever it exists. And as Richard Horton, the editor-in-chief of The Lancet, wrote in 2014, midwifery is much misunderstood. And that's a real challenge for us when we're trying to explain what we do, why we do it, and why it matters every day. But you know, midwifery doesn't need to be misunderstood anymore, because we understand it very well and we can describe it and we can evidence it. In 2014, The Lancet published a series of different articles using different methods that evidenced midwifery and its impact. And I'm going to start today by reminding us of this. Midwifery is not the problem. Midwifery is a vital solution to the challenges of high-quality maternal and newborn care for all women and babies in all countries. And that is what the evidence tells us, and that is what you're doing. I'm going to take you on a little personal journey. Canada, okay? You're not sitting in Murrayfield Stadium, the glorious Murrayfield Stadium. You're coming with me to Alberta in Canada. In the middle of the 80s, if you can imagine that. And I was working there, and actually the roots of the Lancet series for me happened there. I don't know how many of you know, but for quite a long time, right through probably on into the late 80s, early 90s, Canada was the only high-income country in the world without legal midwifery. Did you know that? Some of you did, maybe some of you didn't. And it was an astonishing country to work in if you understood midwifery, to see how their model of care worked. I was, I suppose, one of the original founders of the Alberta Association of Midwives, and as such was pushed out to be the spokesperson a lot of the time. And there was a lot of discussion about midwifery, why midwifery mattered, why Canada should legalise midwifery, why should it bother, said a number of people. And I found myself confronting the media often to answer the question, so why does it matter? What do midwives do? What impact do they have? Why does it matter? And you know, I couldn't really tell them because there wasn't a strong evidence base. I could tell them what people said. I could tell them what people experienced. I could tell them about international examples. But I couldn't say, here's the evidence. And it was really difficult. And I thought, I don't know how to do this. I don't know how to do this properly. And I was challenged really a lot to think very hard. What is midwifery? Why does it matter? Because I could see, I knew in my bones how much it mattered to be a midwife and what we brought to women. But it was very hard to convince skeptics of that. So, again, back to the global lens. The Lancet series on midwifery was commissioned in 2011 because a whole lot of global organisations recognised this problem and recognised that midwifery matters, but it was really difficult to describe its impact. They got together, funding from the Gates Foundation, support from the Lancet to say, right, what is midwifery? Why does it matter? What's the evidence? Does it really make a difference? Why is it better than obstetric nursing? Why is it better than just having obstetricians? So this big coalition of 35 senior people, interdisciplinary, right across 5 continents, all got together to think this through. I'm not going to bore you with the methods. I'm going to show you a little bit about what happened 3 years later when we were able to tell the world, first of all, what midwifery is based on evidence, okay? Midwifery is there for all women, babies and families, no exceptions. Across the whole maternity journey, preconception, pregnancy, labour and birth, postpartum and the early weeks of life. Working in the context of the woman in her family, taking into account her socio-economic status, her culture, her geography, and everything about her. That's what midwives do. Midwives have skilled, knowledgeable, compassionate care for all across that whole continuum of that journey. They optimise normal processes of reproduction, timely prevention and management of complications, collaboration with and referral to others, with respect and partnership and strengthening women's own capabilities integrated within the health system. Because, of course, it should all go without saying that, for this to work, it has to be integrated and supported in the health system. It doesn't work alone, it doesn't work in isolation. It only works to proper standards and when it's integrated and supported. But when it is, this is what it can achieve. Right. Full scope quality midwifery care supported within the system does this every day, every country, all around the world, and here in the UK. And I'm just going to let you read this as we go around the circle. Can you read it? Do I need to read it out? You can read it. So, we're talking about mortality here. we're talking about serious morbidity for mothers and babies all the way around. We're talking about experience and improving those processes. We're talking about intervention use. We're talking about public health on all fronts. And we're talking about the health system benefiting by improved use of resources. Midwives can feel incredibly strong and incredibly proud about the contribution they make every single day to women, babies, and families, here in the UK, here in Scotland, and globally. All the evidence from this was picked up by global organisations and has been moving in and influencing policy and influencing practice across the world ever since. The language the WHO uses now about maternity care has shifted. They used to talk about skilled birth attendants. They now talk about midwives. They are now, here's a few of the global documents that have been produced over the years. The government of India introduced professional midwife training for the first time as a consequence. That evidence is strong and it's still reliable and still evidences the importance of midwifery. Let's think about the UK and let's think about Scotland. That's all very well at a global level, but blah. How do we know here in the UK what midwives are supposed to do, what midwives do, what they can do? Here's a reminder for all of you and a request that if you haven't read your regulatory standards recently, please go and read them. That's just a wee request from me, because I think you will find words there that help you. What these regulatory standards do is define what midwives are and do across the whole UK, the scope of practice, and what all students must learn. Students in the room, Listen, I'm with you, all power to you. It's a really difficult time to be a student, and students online, the same. Well done. This defines your scope of practice. This is what you're currently learning, and this is why you're learning what you're learning. It's all evidence-based and informed by the voices of over 1,000 people to create these proficiencies. Introduced in 2020, we've only got a couple of cohorts through who have learned this. And so really everybody should be reading this and practicing midwifery to the standard. I'm going to pick out just a few words about why this matters. This document defines the scope of practice and essential attributes. Midwives respect and enable the human rights of women and children, and their priority is to ensure that care always focuses on the needs, views, preferences, and decisions of the woman and the needs of the newborn infant. Incontrovertibly, that's what midwives do. Midwives are fully accountable as the lead professional for the care and support of women and newborn infants and partners and families. You provide care based on the best available evidence. You keep up to date with current knowledge and skills, thereby helping to ensure your care is responsive to emerging evidence and future developments. You work in partnership with women, enabling their views, preferences, and decisions, and helping to strengthen their capabilities. These standards are based very much on the Lancet series evidence, and you can feel very confident in them. There are 6 domains. Again, if you haven't read them recently, go and have a look. But there is a bit of a challenge for midwives at the moment, that midwives aren't always able to practice their full scope of practice. And there is a bit of a gap between the care that midwives want to provide and the care that midwives are able to provide. And that gap can be very distressing for midwives, and it fragments care for women and babies, because that's not necessarily there and in place, and it needs to be tackled. We saw this very clearly in a report I did for Northern Ireland that was commissioned in 2023 and published just last year. And you can read the whole thing in full at that link, and you can download lots of slides if you want to look at them about that report. Today, I'm only going to talk about the positive findings from that report. There's negative findings, of course, and they're really important. I've talked about those a lot. I want to talk to you about the positive findings. What were the strengths? Because we went looking for the strengths. What was important for women? I'm going to just let you read this. These are some of the comments that women made about their experiences in this system. That final quote there, "I have never felt so held by the NHS," was a woman who lost her baby and who said her care was astonishing. So it's not only women who have bad outcomes who are, if you like, traumatized. You can make a difference to the way she is, even through the hardest of times. What was valued by staff and students? Summary of those quotes is basically each other. Not just each other midwives, but each other, the whole interdisciplinary team working together. And some of those comments came from obstetricians, by the way. It was very much that integrated team working that they supported and valued. We then analysed examples of positive practice that was going on in Northern Ireland. For what was it that was working in that positive practice? And these are the attributes that we pulled out of about 15 examples. We went through and we asked people what was working, why did it work? And these were the things that consistently, every single example said. Now, these were lots of different examples doing lots of different things. Partnership working, a shared focus, values, philosophy, vision and culture, evidence-based care and standards, positive interdisciplinary team working, enabling and supporting midwifery services. Whatever the topic, whatever the context, whatever was going on there for women and babies, there was midwifery care in as the fundamental part of that service. That was borne out when we then did a big set of evidence reviews and listened to all the interdisciplinary voices and all the women and babies that we listened to about what was it in the system that worked. What would make a health system work for every woman, every baby, every family, and indeed for the staff who worked in it. I could spend the rest of the day talking about this wee diagram. Please go and read about it in the report, because it really matters. There's only one thing I want you to see in this diagram, and it is the bottom section here, okay? Whole system support for universal, accountable, quality midwifery is not there because I was doing special pleading for midwives. It's there because if you take it out, the system doesn't work. Midwives are the only professionals there from beginning to end of the journey for women and for baby and for all women, all babies, all circumstances, all contexts, all settings. Midwives are the glue in the system. They are the fundamental platform on which everything else is built. And you can't take it out and you can't weaken it without care and quality and safety being compromised. We turned that diagram around. I thought you'd just like to see this. That last diagram was the perspective of the system. This is the perspective of the woman and the baby, right through that maternity journey. So from her point of view, at every single step of her way, right through that whole journey, she needs all those key conditions to be there for the system. But absolutely, she needs that whole system support for quality midwifery. And these words here, if you can read them, it's a bit faint on a screen here, so I'll read them out. But these are the words that midwives, women, interdisciplinary staff, everybody used consistently about the care they wanted to provide for women. Respect, kindness, trust, relationship, continuity, prevention, support, and evidence. And if you go to your own regulatory standards for midwives, you will find all of those words over and over again. But midwives in Northern Ireland were telling us they couldn't practice their whole scope of practice. They were finding very limited and constrained, and it was really difficult for them to do the job that they wanted to do. But we know that you are educated and trained and able to provide that. We need the system to wrap around and enable that work to happen. Don't try and read the small print, please. That's not the point. Please, 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 don't strain your eyes. These are the recommendations from the Northern Ireland report, and I'd really quite like some of you to go away and read them. The reason they're like this isn't just because it's a nice midwife's wheel, although it is. It's the fact that they all fit together. You can't pull one out without doing all the others, because the system has to transform. We need the system to work with us to allow us to give the care that women and babies need. I would talk through it in more time. I have previously talked about it, but I just want you to see that there are steps that can be taken, informed by evidence, informed by experience, and the considered views of a lot of people, to provide better, safer care for all. It is possible, is what I'm saying. The system can shift to provide that care. There are steps, feasible steps, that can be put in place. But we need to do that in a collaborative, concerted, whole system manner. One or two of the examples of these just that relate to midwives, there are lots that relate to other people in other parts of the system. There needs to be a regional plan, a whole system plan for access to safe, quality midwifery care. And the unique potential for maternity and newborn care and services, especially midwifery care, to be the foundation for improving health and well-being and reducing inequalities should be recognised. There must be senior midwifery representation at all board discussions about maternity care. You'll like this one. All labour wards should provide a positive, calm labour ward environment to prevent anxiety and optimise outcomes and experiences. All midwifery students and newly qualified midwives must be enabled and supported to learn, consolidate and practice the full scope of midwifery knowledge and skills as defined in the regulatory standards. We could go on. All those things are in there. So, it's a very difficult time at the moment for everyone in maternity care. I want a special shout out to midwifery educators. Where are you? Tricky times indeed. They are doing a fantastic job, and together with the students, weathering this current storm. What I would say is, to conclude, this, on the face of it, looks like individual brilliance. If I was his mum, I'd be a bit chuffed. However, it's not individual brilliance. This is teamwork. This is commitment. This is common purpose. This is respect. This is support. This is practice. This is courageous leadership that enables that kind of brilliance on a day-to-day level, which is what is needed to keep all women, all babies, all families safe. And this is what we are all striving for. I think if midwives have a motto, it's this: safe quality care and services for all, everyone, whatever their circumstances, whatever their needs, they need that. But to provide that across the whole journey that women and babies and families need, they need the system to recognise, value, fund, support, and protect their role, your role. Midwifery needs to be strengthened, not weakened. It needs to be visible and enabled right across the maternity journey and right across the system. And if we could achieve that, the impact would be huge. This woman and this baby are at the start of their lifetime journey together. This is not the end of their journey. This is the start of their journey. And this and every other interaction that they have with health professionals of all sorts will affect that journey for good or for harm. Women are very porous at this point. Whatever is said or done will affect them physically, psychologically, emotionally. The long-term gains of getting this right are huge. We all know the evidence of the physical, mental health, development, attachment, family life, breastfeeding, everything that results from this kind of care. We need to make sure that that actually happens for everyone. So I'm just going to remind you, you are there for every woman, every baby, right through their maternity journey. And if you take that away, women will be rendered much less safe. This is the impact that you can have every day of your lives on women, babies, and families. And that is what the evidence incontrovertibly says. Midwifery, I have to say, is not the problem. Midwifery is a huge part of the solution. And you're doing it every day of your lives for all women, all babies that you care for. So regardless of how hard it gets, you can believe in your hearts that this is actually what you're doing for women and babies. And I know you give it your absolute best every day, and you will keep doing that. Thank you very much for absolutely everything you do.